This is a diagram of the female reproductive tract. And this is showing the uterus, which is the womb, showing the ovaries, the fallopian tubes, the cervix, that's the neck of the womb, and the vagina. What is ovulation? Ovulation is simply the release of an egg from the ovary, and it is very important for conception. It is a very important part of the menstrual cycle. Ovulation occurs around midway through the cycle. That's about 14 days. For a cycle that is averagely 28 days. So ovulation takes place in a woman who has an average menstrual cycle of 28 days around the 14th day. Okay, research has shown that if a woman ovulates, it takes 14 days for her to see her next menstrual cycle. That's for her to bleed next time. Okay, ovulation, as I said, is the release of an egg from the ovary, and it can happen in either of the ovaries every cycle, most times alternating. Okay, so let's assume that in this current cycle, okay, so this is the right ovary, this is the left side. Okay, so this is the right ovary. If the right ovary is the one to ovulate this month, it means that at the right time when the egg is supposed to come out, it pops out of this ovary. Let's assume this is the ovary, and there are many eggs inside. When this ovary opens to give way for an egg to come out, is what we call ovulation. When ovulation occurs, that's the egg is being released from the ovary. These finger-like structures here are like ready. Pick it up and then they push it upwards, okay, towards the fallopian tubes. And in the fallopian tubes, there are hair-like structures, all right, and also the muscular squeezing or contraction that this tube undergoes that helps to push the egg towards the uterus. Okay, so the fallopian tube has this widest part here called the ampulla. Okay, that is where fertilization occurs in the fallopian tubes if the woman has sexual intercourse, okay, that makes sperm to reach that egg. That is where fertilization will occur, because fertilization is basically the joining of that egg and the sperm to form a zygote. Okay, so if a woman ovulates and this egg moves into the fallopian tubes, in how many days or months does that egg disappear or leave the body? Now, the egg after ovulation can last in the woman's system for about 12 hours to 24 hours. That is half a day to about a day. And what happens to that egg after that time? The body has a way of absorbing it, so it just takes it up. It doesn't need to excrete it. And most women, when they discover that they are having a discharge that looks like egg white, okay, the thought is always that it is that discharge from the egg, whatever, that comes down. No, that is not the case. That discharge, I'm going to talk more about it in another video, but I want you to know that the body has its own way of absorbing that egg and all that it contains, so that the body can continue the menstrual cycle as it should go without any pregnancy. Okay, so in summary, ovulation is the release of an egg from the ovary at the right time in that menstrual cycle, and the egg can last in the woman's body for about 12 to 24 hours if there is no fertilization. Okay, after that the body absorbs it.